Good morning to you. Good morning to all those who make this broadcast possible, to Gisela, who supports us from the studio, and good morning to all our audience tuned in. Today is a relatively favorable day. We have one case in serious condition and no patients in critical condition, no fatalities. Today we have 142 patients admitted to our hospitals, 9 in vigilance, 84 are suspects, and 49 are confirmed. 49 that are the active cases we have today. In our primary healthcare system, our professionals follow up 131 people. Yesterday, the island's different molecular biology laboratories studied 2,690 samples to detect COVID-19. In the Pedro Curie Tropical Medicine Institute, 1,084. In Havana's Provincial Center, 376. In Villa Clara's, 341. In Santiago de Cuba's, 276. In the Genetic Engineering and Biotechnology Center, 105. In the Brother Amejeiras Hospital Laboratory, 354. And in the laboratory of the Civil Defense Center, 154 samples. As a result of the analysis of these 2,690 samples, 8 people tested positive for COVID-19. Since last March 11, when Cuba began to diagnose the first cases, the island accumulates 178,062 samples studied and 2,361 people who have tested positive after the analysis of these samples. That is 1.3% of the samples. As it has become customary, we inform that all provinces processed samples yesterday. The most significant number are those from Havana, of which processed 1,661, Artemisa processed 76, Mayabeque 144, Matanzas, who followed Havana in terms of the most numbers, it processed 154, Santiago de Cuba 145, Camagüey 80. So all provinces had samples processed for the purpose of detecting positive cases for SARS-CoV-2 and COVID-19. The 8 cases confirmed yesterday all are Cubans, 7 are confirmed case contacts, that is their source of infection, and they already accumulate 2,049 people who have tested positive in our country. 88.3% of all cases have this source of infection being a confirmed case contact. In one of the cases diagnosed yesterday, the source of infection could not be determined, so 107 people, 4.6% in all the pandemic, their source of infection has not been established. With source of infection abroad, the same number remains. We have 163 patients, 7%. Of the 8 cases, 7 are male, for a cumulative of 1,192 male cases, 50.4%, and 1 was female, for a cumulative of 1,169, 49.5%. The 8 cases were asymptomatic at the moment of the diagnosis. Notice this trend in the behavior of the disease. In the last week, we have seen this more often. In the cumulative, we have 1,283 people confirmed in Cuba who at the moment of testing positive showed no symptoms of the disease, and this accounts for 54.3%. When we take a look at the behavior in the last 15 days, 70.3% of all the diagnosed cases diagnosed in the last 15 days did not have symptoms at the moment of the test. This is something quite common in this disease, and And that is why we insist on the measures that we must follow in this phase 1 for Havana and Matanzas provinces, and phase 2 for the rest of the provinces of the country. By age groups, 2 are in the 1 to 19 years of age, 3 from the 20 to 39 years of age, and 3 from 60 and over. The 2 pediatric cases under 19 years of age, one is a 2-year-old male from Mayabeque province, from the San Jose de las Lajas municipality. He is a confirmed case contact. And the other is a 16-year-old male from the Cotoro municipality, who is also a confirmed case contact. The 2 were asymptomatic at the moment of the diagnosis. The cases belong to Havana province, 7, 80.5%, and 1 belongs to the Mayabeque province, 1, 12.5%. The cases from Havana hail from 5 municipalities. Some of them are confirmed case contacts from the outbreak that is open in Cotoro municipality, and in the case of Mayabeque, similarly, it is a confirmed case from the same outbreak there. With this development, Havana lowers its positive rate of confirmed cases per 100,000 inhabitants to 2.67 per 100,000 inhabitants. But nonetheless, it remains with the highest rate. Mayabeque follows with the 7 cases it has confirmed over the last 15 days, with a 1.82 rate per 100,000 inhabitants. And the remaining 13 provinces and the Isle of Youth special municipality continue without confirming cases in the last 15 days. Of the 2,361 patients diagnosed with the disease, 49 remain admitted, active cases. This is the 2.1%. 48 of them have a stable clinical condition. 1 patient is reported in serious condition and is admitted to the Salvador Allende Hospital here in Havana. For 7 straight days, we have had no critical cases. We always regret the death of 86 people who have died due to the disease during the pandemic in our country, and for 6 straight days, we have no fatalities. We have the 2 evacuees at the beginning of the pandemic, and yesterday we had 3 patients discharged. The 3 are from Havana, and we have accumulated 2,224 patients diagnosed in Cuba with COVID-19 that have recovered 94.3%. With the 86 people who have died, Cuba has a lethality rate of 3.64%. That's Cuba's lethality today, versus a 4.69%, which is the current lethality of the region of the Americas, and Cuba occupies the place number 20, the 20th place in the region from the lethality point of view. On the other hand, with this indicator in terms of lethality, Cuba now occupies the 101st place in the world's list of countries confirming cases. The list is headed by the United States and Brazil, the countries with the largest number of confirmed cases and deaths. As of 12 o'clock last night, as we always say, 185 countries continued reporting COVID-19 cases. Yesterday, 219,405 new people were confirmed with COVID-19 yesterday. Please note the alarming number. And there is a cumulative of 10,665,758 confirmed cases in the world. With the 4,936 people who died in the world yesterday, there is a death toll of 515,973 for a lethality of 4.84%. The region of the Americas, as we have said, it remains as the epicenter of the epidemic in the world. It's been like that for several days now, and it confirmed over 124,417 cases in a single day yesterday, and it already accumulates 5,451,474 confirmed cases, accounting for 51.11% of all the cases reported in the world. Yesterday in our region, 3,114 people died in our region for a cumulative of 255,599 deaths for a lethality of 4.69. And this is the information we had today on the behavior of the pandemic in Cuba and in the world.